Really?
About a minute, that good?
Yeah. No, less than that is fine. I'm good.
On August 6th,
I'm up and rolling.
the Police Department game unit executed a search warrant in the 4600 block of Lake Valley Drive.
The sales team is remarkable.
72 grams of fentanyl, nearly 2 grams of cocaine base, about 3.5 grams of cocaine HCI, and 14 grams of marijuana. 47-year-old Jamie Sanders of Fayetteville was arrested during a traffic stop on an outstanding warrant. He has been charged with multiple drug charges in relation to the case. He was arrested on the outstanding warrant and additionally charged with other multiple drug charges. From WIDU Radio, I'm Jamie Monticelli.
Got 30 seconds.
Yep.
This is Pastor Neil of the New Covenant Christian Faith Church Ministries. You are listening to Wake Up. This is Pastor Neil of the New Covenant Christian Faith Church Ministries, 5427 Murchison Road, and I am proud to be a member of
10
Wake Up.
seconds. Move too fast.
We now return to Making Rounds Live.
Cape Fear Valley Making Rounds Live.
Broadcasting and streaming live on the WIDU network, 99.7 FM, 1600 AM. Here's Omega Jones.
Well, thank you, Ray. Welcome back to the second segment of Cape Fear Valley Health's Making Rounds Live, streaming live on Cape Fear Valley's Facebook page and on YouTube. Now, before we continue our back-to-school discussion with Dr. Troxell, I need to say hello to Miss Wanda Wesley and Ms. Dorothy Fielder. They are with the Umoja Group. Now, what I want you to do is don't forget that the 34th annual Umoja Festival takes place on Saturday, August 29th. And as always, Cape Fear Valley Health is providing a free health clinic during the Umoja Festival. Now, you will be able to get free health screenings. You'll be able to see, to get physician consultations, health education, resources, and this is for uninsured and underinsured adults here in Cumberland County. Starts at 10 a.m., goes up until 1 p.m., and it is going to be in the Smith Recreation Center at Seabrook Park, which is across from Capel Arena at Fayetteville State University. Now remember, this is Saturday, August 29th. Walk-ins are welcomed, and patients will be seen on a first-come, first-served basis. And you can visit Cape Fear Valley's website, which is capefearvalley.com, for more details and additional information. And once again, ladies and gentlemen, students are heading back to the classrooms in a couple of weeks. And today we're talking about something every parent should be thinking about, making sure that their child is healthy during the upcoming school year. And our in-studio guest today is Dr. Andrew Troxell, and he is a resident with Cape Fear Valley Health. Now, before we went into break, we were talking about the different misconceptions and the different the misinformation that was out there about vaccines. So, Dr. Troxell, where can families find reliable, science-based information if they have questions about these vaccines?
The biggest place is going to be from your pediatrician, having a conversation about the vaccines, what to expect from them, what they do, how they work. All of these things are things that most any doctor can talk to you about. Your pediatrician works a lot with those vaccines and children and can give you an in-depth amount of information about that. Sticking to that source really helps avoid a lot of things that are unverified or things that people feel and then treat as fact and put out there on the internet. And so using those reliable sources is really important. Your pediatrician can also direct you to other sources that you can look into and get more information on for those things.
Let's talk about side effects. What is considered normal after receiving a vaccine, and when should someone contact their personal physician?
Some of that depends on the vaccine itself. I hear all the time that I got the flu from getting the flu vaccine, and there's actually a reason for that. There's a chemical that your immune system uses called interleukins, and they're how you respond to certain diseases. And the part of the flu vaccine that gives us the immune response triggers some of that, and those compounds are actually what makes you feel crummy. You get the flu. And so it's not surprising if somebody feels like they have the flu after they get the flu vaccine, especially first couple times that they get it. That typically fades over time once your body gets more used to the different components, like I talked about, of the flu vaccine. And it's not due to you being sick, it's due to your body thinking that you're sick and responding to it like you're sick, which is exactly what we want with that vaccine. Some vaccines, based on what they are or what they're doing, can mount more or less immune response to different parts of your body. Getting a low-grade fever is not terribly surprising. Being stiff or sore, any sort of injection site irritation, if that's going on for a while or getting worse over time, that's something to be more concerned about. But don't go punching people in the arm if they just got a vaccine, sort of thing. Talk to your doctor when you're getting the vaccine or your child's getting the vaccine about what side effects they're concerned about or they would want you to call back with. They can talk to you about that for each of the vaccines. And then if you're ever concerned about something or you just don't know what's going on, you should be calling them and talking to them about that.
Fear of needles. Everyone has them. Well, the majority of folks have them. What can families do to make sure things are less stressful for their students and their babies, no matter the age?
Your response is really important for kids, and how you set it up is really important for kids. If they start crying and you start crying, they're going to see that as kind of a normal response. Or if you get mad at them, they're going to see that they did something wrong and feel worse about that. Talking to them ahead of time, being honest that it's not going to feel nice, but it's okay. We're doing this for a reason. This is good and helpful, and we're keeping you from feeling really sick for weeks in the future, potentially with this. Can help kind of build their understanding about that. The more that people understand going into something stressful or painful or disruptive, the better that they typically feel throughout that process. There can be some pain without the suffering associated with that. We see this during childbirth. It's incredibly disruptive to the body. It hurts a lot, and people do it not once, but multiple times because there's something that you're doing it for, and having that mission or motivation for it can really help protect against any of the distress that comes with it. Offering a reward for good behavior with vaccines or brave response is going to be better than offering a punishment for tears. Keep those things in mind, and it'll help reduce some of that. There's nothing that's going to make it not hurt. Not painful.
For students with chronic medical conditions like diabetes and asthma, are there additional considerations that families need to discuss with their healthcare provider?
There are certain populations that are going to be more vulnerable to different diseases. So if you have asthma or other respiratory conditions, there may be additional vaccines that, depending on your functionality and how things have been going lately, that your pediatrician may want you to get. There are certain immunocompromised patients that shouldn't be getting certain vaccines. So having that as part of the discussion, but again, none of this should be something that you're having to figure out on your own. It's talk to that doctor that does this all day long to know what to do for that child.
Let's talk about physicals. Why are routine physical exams important as students head back to school?
You want to catch problems before they become big problems, and a school physical can do that. So there's things that we're looking for, like respiratory conditions, vision, hearing changes, cardiac conditions that we can pick up on early before anybody else may be noticing it, and treat before it becomes something that's impairing. Some of these things can get worse over time or cause lasting effects. If vision changes aren't picked up on, your child may lose weeks or months of school where they can't see the board or hear the teacher talking. And that's really hard to catch up on. But figuring that out at a physical before school starts back up can set you up for success over the course of that year. Checking in on these things and making sure things are up to date, that the medications are still right for your child's age and weight are really important. And having that point in time to touch base and focus on this and get everything in order is really important. So there's a lot of different benefits of timing it with the school year, just transitioning to a new group. As you're an adult even, you probably want to have a time of year, maybe your birthday or the week after Thanksgiving, where you have things kind of regularly set, where you're checking in on your own health and making sure that things are up to date so that they don't get worse and out of control over time.
Annual wellness exams, you just mentioned taking care of your own health. Annual wellness exams and physicals, are they the same thing or are they different?
There are a couple different types of checks that we do regularly. One would be like sports physicals, and that's looking at some different things, focusing on things like heart and lungs and how they'll do under exertion and stress, so that there's not something that happens on the field that harms or even potentially kills a kid. Other child exams would look more at things like metabolic issues, potentially laboratory screenings, or staying up on vaccinations. You won't get as much vaccination talk at a sports physical as you will at a child exam, and at a child exam they won't be looking as aggressively at some of these things that would be triggered by exertion. So again, I want to go back to talk to your pediatrician, make sure that if there are things that are changing in the school environment, or there's additional sports that they're looking at, or you're noticing any changes with your kid, that there may be a different type of visit or a different specialist that they would want you to see or talk to.
You were talking about vision and hearing problems during the first segment. Some of those things, they can go unnoticed. Why are those vision screenings and those hearing screenings, in case someone is just joining us and they missed it, why are those screenings so important?
It's really easy to miss things that change slowly. And if there are problems like vision or hearing problems that gradually build over time, it may be that it's not causing much of an issue, and then the issue is something that they can kind of compensate for before it goes over into causing a problem. And during that whole period, there may be extra stress or trouble with your child trying to figure out how to navigate this world where they're not seeing things or hearing things as clearly as their peers do. I wear contacts. I absolutely pushed it off as long as possible when I was a kid. I didn't want to tell anyone that anything was wrong, and it went to the point that I left the eye doctor appointment with a new pair of glasses, and I looked at the trees and I said, "Mom, I can see all the leaves." And it had been a blur before, and nobody picked up on that because I compensated in other ways, and I saw some of the things that I needed to see, or I was close enough to the chalkboard that I wasn't having problems at a distance. But when you transition back to a corrected or more standard sensation, vision, hearing, that adjustment is huge, and you notice that. Gradually over time, losing some of those senses is not as easy to notice.
What are some of the signs that parents need to look for, since it is something that's not immediate?
Yeah, with vision, there can be things like the child goes towards the classroom, so keep in touch with teachers and see what they're seeing in the classroom. There can be things like developing headaches if you're trying to read and your vision has trouble with that, or your eye strain is happening from really stressing things, trying to work at maximum function all day long. If a child's asking what all the time, it may not be that they're not paying attention, it may be that they are having trouble hearing. And it's hard to kind of jump to that. You know, if we see a child that doesn't answer you when you call them, it's easy to say, come on, pay attention. But it may be indicative of something more going on in the background. And so watching for, again, those changes over time. It's hard to notice week to week, but if you look back at a year ago, are they not seeing the things you would expect them to compared to how they were? Are they not listening as much as they were before, but it doesn't seem like behavioral? Sometimes it's like, come get a slice of cake, and they don't hear you for that. So just keeping track and checking in. And again, that once a year visit kind of sets that point that we can evaluate and compare to prior years. How is growth doing? How are these senses doing? How is the child as a whole doing? To set that benchmark and catch those changes that may be happening more gradually.
Ladies and gentlemen, our in-studio guest, Dr. Andrew Troxell. He is a resident physician at Cape Fear Valley Health, and he is giving us all of the information that we need to know to get your child ready for the upcoming traditional school year. Dr. Troxell, let's talk about teenagers for a moment. Are there health concerns that become especially important once students reach those middle school and those high school years?
Yeah, every doctor kind of sees the world through their own specialty's lens. I'm no exception to that, so I'm going to say psychiatry and psychiatric concerns. But this is especially true in the teenage years. Mental well-being can suffer hits as these social relationships get more complex, and there's challenges, and there's transitions in the school from from middle school to high school, if there's bullying for them or a friend, or potentially if they're the bully. These can all have effects on mental health. And picking up on those conditions at that time can help before it gets out of control or worse. Teens additionally start getting into this environment where there's opportunity for risky behaviors as they leave some of the support of the home, as they have more activities outside of school. There may be exposure to things that teens probably shouldn't be doing, like sexual relationships, drug or alcohol use, dangerous, risky driving behaviors, all of those sort of things. And checking in, having a conversation with the pediatrician about those things can be helpful. You know, sometimes it's hard for a child to talk about these things with a parent or admit to some of these things with a parent. But having a doctor who talks to you about confidentiality and somewhere that you can kind of leave those issues once a year and forget about it for the next year can help have more of an open conversation with those things.
What are some of the warning signs that parents and families need to watch for?
Emotional instability would be a big thing, like getting really angry or really sad really quickly. That would be concerning. You know, all of this is in the context of they're moody teenagers. It's hard to see when you have your smaller family compared to a bigger population of students. But if you notice that compared to their peers, they're not seeming as happy as often, or things that used to make them more excited don't, or you catch them crying or not wanting to talk about certain things, that may be concerning. Sleep is also something that can kind of be a monitor for other things going on. If they're sleeping way more than you would expect, again, we're talking about teenagers here, but if they're staying in bed all day long, or if they're unable to sleep, those are things that can point to concern. Sleep is a huge challenge for a lot of people. So having a home environment that's supportive of that sleep and encouraging sleep, while also catching if it's getting to the point where it's related more to emotional distress than anything else, is important.
Dr. Troxell, teenagers may, you mentioned earlier, teenagers, they may not always tell their parents or their family members when something is wrong. Once again, in case someone, they have heard it, could you tell the parents again the changes that they need to look for?
Yeah, the sleep and the emotional reactivity would be two big things. Another would be something like dietary changes, like if they're not eating, or if they're eating way more than you would expect. If they're going into swimming practice and their diet changes for that season, that's one thing. You know, if there's sudden changes that weren't happening before with diet, or potentially even food preferences, or how they're eating, taking their food to their room instead of eating with the family, these could be things that can be used to kind of identify other issues that are going on. Another thing would be big changes in grades. If it's gradually changing over time, it may be a harder environment, or they may not have as much support, or it may be any other number of factors. But if it's a sudden drop in grades from one semester to another, or 1 year to another, that's something to watch for more closely.
Let's talk about sleep. Because I heard my daughter talk about this with my granddaughter. It's a major adjustment coming from summer vacation, going back into school. How much sleep do students need at different ages, and what can families do now to start getting their child acclimated for the upcoming school year?
The biggest identifier of how much sleep you need is your own body. If you don't have an alarm, how long are you going to sleep? Bodies don't really sleep much more than they need to if there's not other things going on. And if you notice that a child, when kind of given the freedom to not wake up at the early time to get ready for school, is sleeping a little longer, it may mean that bedtime should be a little earlier. It ebbs and flows over time. If there's more physical activity, they may need more sleep. If they have a respiratory illness, they may need more sleep. But there's some guidelines. School-age kids up to 12 should be getting 9 to 12 hours a night. Teenagers need 8 to 10 hours a night. A lot of people aren't meeting that. There's tons of disruptions that will happen. A baseball game that they go to with their friends that they come home late from, or a school activity may get in the way of sleep. If they want to wake up early and look over things before tests or homework assignments, that may get in the way of sleep. But trying to point the needle a little more towards getting that adequate amount of sleep. If you try and make changes overnight, it's not going to work as well. It's kind of gradually moving there over time. preparing for that, having an environment that's supportive of sleep. If your kid comes downstairs and you're like, you slept the day away, it's gonna make them feel bad about sleeping. If they were out late the night before, or if they were doing a lot of sports activities and they're tired and sleeping more, it's positive to tell them that they got the sleep that their body needs to grow and develop and stay healthy.
Let's talk about nutrition. A lot of sugar snacks out there. I see a lot of energy drinks out there. I see a lot of processed foods out there. What does a healthy school breakfast and a school lunch look like?
The less processed foods you get, the better. I'm gonna ruin orange juice for you real quick. One of my favorite things is things that sound like conspiracy theories that aren't, and orange juice is one of them. In the process of pasteurizing and preserving orange juice, they deoxygenate it, and it destroys almost all of the flavor compounds associated with it. So that all gets added back in, and it actually happens at perfumeries. They take orange peels and orange pulp and extract chemicals that create these flavor packs that get put back into orange juice before it goes to the store. And it's the reason that orange juice tastes exactly the same per brand all year round. And different brands have different flavor packs that they use that cause the taste to vary between them. The closer that you can get to something like squeezing an orange instead of getting the store-bought orange juice is going to be healthier. The more fruits and vegetables is always going to be healthier. And making sure that a diet works well for your kids staying full and energized and with enough nutrition throughout the day. So healthy fats and proteins will do that. The big offenders are going to be things like bagels, muffins, cookies for breakfast, donuts. It will spike your blood sugar really quickly. It'll give you a burst of energy. When that comes down, as your body adjusts to that elevated blood sugar, it will make you feel more tired. And so if that starts happening during their second period at school, they may not do as well during that period. And then you're going to be hungry by the time the lunch comes around, and you may overeat or make worse choices at that meal. So starting off with something that's filling, nourishes your brain, your body, gives you energy throughout the day, that's going to be the best choice.
Ladies and gentlemen, Dr. Andrew Troxell is our in-studio guest today on Making Rounds Live. We're getting your child healthy, keeping your child healthy, and getting them ready for back to school. Dr. Troxell, due to homework, cell phones, video games, classes, our children, they're sitting around more. So how much physical activity should they be getting each day? I already know they're not, but how much physical activity should they be getting each day?
Not as much as they are. Around 60 minutes of moderate to vigorous activity a day. And again, just like sleep, it's something where pushing the needle is going to do better than really trying to jump into things and achieve all the goals at once. So if you can introduce activities like a walk with the family after dinner, that's going to be good for everyone in the family. If you can get them to do one more activity at school than they were doing before, that's going to be a move in the positive direction. And it's not an hour all at once, it's spaced out throughout the day. If there's activities that they're doing outside, games with friends, sports that they play, that will likely cover that most days. And pushing to have as many of those days kind of in that 60-minute or more window is going to help with health effects long term. You know, the benefits of exercise really can't be overstated. We see it connected to heart disease, lung disease, mental health and wellness, immune responses, just generally having a well-maintained body, a body that does these things all the time, is a body that can survive things that pop up in the future. Developing good weight training as a child and as an adolescent, lifting weights, can help improve bone health over time. As you load those bones, they get stronger, and that helps prevent hip fractures and early deaths in later adulthood.
Dr. Troxell, since we're coming up on the end of the broadcast, one thing that I want to ask, are there resources available through Cape Fear Valley Health to help families with wellness visits, vaccines, and those routine care?
Yeah, there are a number of pediatric practices associated with Cape Fear Valley that I would love if you got your care at. If there's a pediatrician that you're following with that you trust, that's going to be the biggest thing for you. There is a directory of providers that you can look at if you're looking to establish, if you're new in the area or looking to change physicians offered through Cape Fear Valley. And there's some community support as well. If there are insurance or financial issues, the health system can help with that as well. So don't be afraid to reach out and see what's available and get those things teed up before school starts.
And finally, Dr. Troxell, since we're running out of time, is there something that I didn't hit upon during this past hour, or is there one message that you want families and parents to take from today's conversation?
The big thing with all of this is so corny. It's that an ounce of prevention is worth a pound of cure. And with flu vaccine specifically, an ounce of the thing in the flu vaccine, the hemagglutinin, that causes the immune response and gets you protected against it, 1 ounce of that is enough to prevent 190 deaths for people. These are huge things. Working on exercise, sleep, diet, gradually over time to get you to a good place, making sure that your health kind of maintenance tasks are all teed up is the best way to stay happy and healthy, avoid missed days, avoid sick days, avoid parents having to stay home from school with kids, stay home with kids from school if they're sick. The things that you do now are really long-term investments in your future health.
Oh, one question real quick, and Paul, please don't strangle me for this. When a child is sick, when should they go to school and when should they stay home?
If they have a really high fever, they should stay home and probably see their primary. If there are other symptoms of concern that they haven't really been demonstrating before, like chest pain, not like you cough and it hurts for that moment, but if it's constantly hurting or if they're constantly throwing up, things that are really outside of the behavior that's normal for them when they're sick should be things that you keep them home from school and that you see your doctor about. I imagine that most parents know what their kid looks like when they get sick, and I hope that most parents don't know what their kid looks like when they get really sick, but those typically are two different things, and if it doesn't just look abnormal for them, it looks abnormal for their abnormal, that's something to talk more about with your doctor.
Ladies and gentlemen, Dr. Troxell, thank you so much for taking time out of your busy schedule to be with us today. And this has been an amazing conversation. Thank you so much.
Thank you.
Ladies and gentlemen, Dr. Andrew Troxell, he is a resident physician at Cape Fear Valley Health. When you see him out at the hospital, make sure you tell him hello and you saw him on the broadcast. And this wraps up today's edition of Cape Fear Valley Health's Making Rounds Live. Mark the date. Our next broadcast is Tuesday, August 25th. We're going to be talking about the upcoming Umoja Festival. Remember, there is a health clinic that will be part of the Umoja Festival. Cape Fear Valley Health is sponsoring that. It will be from 10 a.m. until 1 p.m. Free health screenings, opportunities to speak with physicians, community resources, and so much more. So make plans to join us. For our in-studio producer, Mr. Ray Thomas, our engineer, Mr. Paul Matthews, and the amazing team behind the scenes, I'm Omega Jones, the trusted voice that connects communities. Thank you so much for listening to and watching Cape Fear Valley Health's Making Rounds Live.
Yeah.
Can you stay there for a second? I'm gonna get a